back. We're on the final stretch of Talk to Doc, and it's time to take some questions from our studio audience and email senders. Any questions?
Doc, meron po bang age limit for breast reconstruction?
Actually, no. It really depends on the medical status of the patient. You know, as long as she's healthy and she still desires to have a new breast, any patient can actually undergo breast reconstruction. It's one of the common myths. Sometimes they even say if a patient is stage 3 or stage 4 breast cancer, they can't undergo it anymore. But you have to understand that it actually doesn't affect your survival rate or how you deal with the breast cancer. What affects your survival rate of the breast cancer is at the stage at which it is diagnosed. So whether or not you undergo breast reconstruction, that doesn't change. In some centers abroad, they are so aggressive that they consider it as part of palliative care, which means if a patient is already stage 4, no, she's dying, and she wants to die with 2 breasts, then you can actually do it for her. If it makes her happy, if it improves the quality of her life for the next few months or years that she's going to have, then we can do it. But of course, we're also really very careful about this because this is still surgery. So we subject the patient to all these laboratory examinations. We evaluate the patient. We pick up any red flags and we correct them. And if we think that she's healthy enough to undergo the surgery, then we'll proceed with it.
So any stage, any age?
Yes. How young? Do you have young patients who had breast cancer?
The youngest patient I've done is an 18-year-old.
Really?
Yeah, 18-year-old. She had a very strong family history of breast cancer.
Cancer patients are getting younger now.
Oh.
Yes.
Yes.
And partially, I think it's because of improved screening.
Correct.
Patients are more aware about it now, so we get to pick it up early. Yeah, so that's also a good thing because the earlier you pick it up, the higher the survival rate.
That's true.
Yeah.
Next?
Pwede rin po bang magpasuso pagkatapos ng breast reconstruction?
Breastfeed, no?
Yeah,
Yes,
actually no. Yeah. Well, you can breastfeed with your other breast, no? When we reconstruct kasi, di ba, I said we can use either implants or your own tissues. Yung implants, syempre wala yon. It doesn't produce milk. Maybe in time. And then if it's your own tissues naman, it's mostly fat. No? So that one has no milk-producing tissues. Well, that's also good because cancer in the first place comes from the milk-producing tissues. So you don't want to really put that back there.
Kaya pala, doctors, they say kung nag-breastfeed ka, less ang chances mo to have breast cancer. Totoo yun?
No, the reason for that is actually it's not the breastfeeding, it's the pregnancy. Yeah, because
the pregnancy protects you.
The pregnancy protects you because it's about hormones in our body. So we have estrogen and progesterone, di ba? When you get pregnant, nasi-shift yung hormone balance. That shift in hormone balance lowers your risk for breast cancer. Yeah.
And you should get pregnant earlier than 30 years old. Is that correct?
Yes.
Madami na tayong napupunta.
Pero
it lessens your risk if you get your first pregnancy earlier than 30.
Okay.
30.
So, yun ang mga bagay na dapat natin tandaan. Okay, any more questions?
Hi, Doc. Can I get breasts bigger than my old ones?
If you're going to undergo breast reconstruction, yes, it can be done, no? But then we also have to think about doing surgery on your other breast to make it symmetrical. Yes, but that's possible.
Naku, ang dami yatang mga gusto pang tanongin ng audience, pero we don't have all the time for it anymore. So we'll ask you, Doc, na for your parting words.
Parting words. I think, really, I just want to increase awareness, no? Because not a lot of people know about this. For me, this is a personal crusade. I think that no woman after breast cancer should have to live with just one breast for the rest of her life. So this, I'm really just bringing a message of hope. We're doing it here in the Philippines. We're doing it in the medical city, safely, consistently. Even the most complicated form of breast reconstruction, or what we call the gold standard, no, perforator flap breast recon, they call this the Rolls Royce of breast recon. We're doing it here in the Philippines. You don't need to go anywhere else.
Correct.
So I think that's what I want to just really tell everybody, and that there are many, many ways to make a new breast. Our patients are always partners because they have to choose the right procedure for them. No form of reconstruction is better than the other. It will really depend on the patient, her goals, her lifestyle, the stage at which her disease is diagnosed. So we come to that decision together.
So thank you very much, Dr. Yen, for sharing your expertise with us. And thank you to all our audience for joining us today.
Well, catch our show next week as we talk about the newest way to treat prostate cancer.
For your questions regarding this topic, email us at talktodoc@medicalcity.com.ph. I'm Dr. JJ Chongson.
And I'm Maricel Laksa Pangilinan. Remember, don't be afraid to ask because we can
Talk to Doc.